Hi, and welcome to today's Engaging for Missouri webinar. I'm Alice Roach from the Division of Applied Social Sciences at the University of Missouri, and I'll be your host today. With each of these 30-minute webinars, we intend to share research-based insights that leaders like you can apply in your own work to benefit and strengthen the state's agriculture and food system, hospitality sector, and communities. For today's webinar, Dr. Tracy Greever-Rice will share about COVID-19's impacts on the health of rural Missourians. Before I invite her to begin, I want to share a few housekeeping notes. First, we'll close today's webinar with a question and answer session. Those of you who connected to the webinar today via your computer can submit your questions in the chat screen. So to open the chat, just click the chat button that you see at the bottom of your Zoom window. If you joined by phone, then you can send your questions to me by email at roacham@missouri.edu. Second, all attendees are muted and may not start their video. Third, if you encounter any technical problems during today's webinar, then you can let me know by either including a comment in the chat screen, or you can also send me an email at roacham@missouri.edu, and I'll do my best to help you troubleshoot. Fourth, we will make a recorded copy of the webinar available to you. You can look for an email from Zoom that shares more about where you can access that recording in about a day from now. Also, we have an archive of all of our previous Engaging for Missouri webinars on our division's YouTube page, so you can access those recordings there. So now we'll transition to the topic of today's webinar, which is titled Understanding COVID's Impacts on the Health of Rural Missourians, Risk Factors and Resources. Our presenter today is Dr. Tracy Greever-Rice, who is the MU Center for Health Policy Director and an Assistant Professor of Rural Sociology. So thank you, Tracy, for presenting today. If you could please start your video and unmute your microphone, then we can begin today's presentation.
Good morning. Am I sharing my screen appropriately?
Yes.
Okay, very good. Thank you very much for joining us today. I'm going to talk a little bit about the health of rural Missourians and things that impact the health of rural Missourians. I am pulling most of my talk today from an internal to MU research report that we've been working on around the impact of broadband expansion on rural health in particular. So we've organized our thoughts on that issue around three particular issues. One is the social determinants of health and understanding the local and personal impacts that have an effect on how well a population is doing in regard to health, and also on actual population health information, particularly in regard to risks for poor outcomes with the COVID-19 virus. And then third, I'll look a little bit at the availability of the rural healthcare workforce here in Missouri. This work that we're doing on this report regarding broadband is a partnership with the Center for Health Policy, the Office of Rural Health, the Missouri Telehealth Network, and MORENET. So many of you may be aware of the idea of the social determinants of health. It's been informing research on population health as well as public health initiatives for about the last 20 years. But if you're not, the general idea is that how well people's physical and mental health is based on the environment that they live in, and environment with a broad definition. The built environment that they live in, their access to health, preventative health and health care, how well their community does, how safe it is, how safe they feel, resource availability, those sorts of issues, access to education and educational attainment, and then economic stability. We know that people fare way better with their health if they are stable in these 5 areas. So with that as sort of an underpinning of that, I want to look at some maps from our map book that look at Missouri at the county level and will give us some indicators of these social determinants of health, particularly the ones around economic impacts. So this is an American Community Survey indicator that looks at counties here in Missouri that have households that are lower than 50% of the federal poverty guideline. So as a rule of thumb, for a family of three, these are households that are roughly like $12,000 a year incomes. So the darker the color in this map, the higher the number of households that have incomes below 50% of the federal poverty guidelines for 2018. And as I mentioned, this was for an internal report. So those yellow framed Missouri counties are counties that have the lowest access to broadband in the state. So you can see it's the poorest counties in the state, with the exception of the city of St. Louis that falls in that same category, are some of Missouri's rural counties, particularly in the southern part of the state. So sort of hold that status as we move through these slides. Another important component in understanding the lived experience of poverty is to think about how much it costs to just meet basic needs. So an important indicator that gets used a lot and that I really like in terms of telling the story of what it's like to be poor is housing cost burden. It is, again, an American Community Survey indicator, and it looks at households that need to spend 30% or more of their gross income on rent, mortgage, utilities, associated expenses, basically keeping a roof over your head. And again, on this map, we're looking at a color ramp where the darker the color, the higher the percent of the population spending that much of their income on shelter. And those highest counties are over a quarter of the population, up to about 40%, those darkest blue counties. And then I've also included a slide that gives a sense of the age distribution across the population. And I want to distinguish the population over 65 from the prior two slides that we looked at that were focused on the economic impacts on the social determinants of health. Because seniors, particularly young seniors, sort of between 65 and 85, are both contributors, frequently both community and economic contributors to their areas, particularly in rural areas. But as people age, they do require different kinds and more care. They bring their own incomes, retirement. They also receive public benefits that contribute importantly to rural Missouri, like Medicare access, Social Security, etc. Missouri is an aging state, and our rural counties are aging faster as a population than our more metropolitan areas. The dark blue counties here are counties where 1 in 5 people or greater are over the age of 65. And then another important determination of health is access to health. And in this case, we're looking at this from the patient perspective. This is looking at the percent of the population with any health insurance coverage. So it includes both public and private coverage. So people over 65 and over are Medicare eligible. And here in Missouri, the Missouri Medicaid program is very generous to kids, covering households, including both Medicaid and CHIP, up to 300% of the federal poverty level. However, Missouri is a low service state and a low coverage state for people of the typical working age range, 18 to 64. So when you look at these counties that have low insurance access, in this case, the counties that we're looking at here in white, that's primarily who is making up that component of the uninsured adult workers. So let's talk specifically about what we know to date about some population health risks specific to COVID-19. And I think it's important to note that what we understand about this virus and its impact on either personal or population health is a real moving target at this point. And we are working from the information that we have. And I'm sure as we move forward, there are going to be some other nuances or specific populations where other conditions are predictive. But a couple things that we do know is that there are people with specific underlying conditions that are at higher risk of poor outcomes, and that's what I've focused on here in these next slides. So one important predictor of poor outcomes for COVID that we know to date is simply being in the older age group. So the higher the older one is, the higher the risks of poor outcomes, and the mortality rates also go up too. So this map simply gives us some information about the percent of the population in Missouri counties who are over the age of 85. And in some of Missouri counties, particularly in our north and north central sections of the state, up to 5% of the population is a late senior. And there are several things that go along with this for rural areas that put people at even higher risk. One, lots of care given in rural Missouri to this particular demographic is happening within a senior living context of some type. And I'm sure we're all aware that group quarters and COVID is a dangerous situation and a risk situation for folks. A couple of other factors, and I'm hesitating because as COVID information rolls out, some of this is going to change. But when we started thinking through what this is that the further away you are from the level of medical care necessary to treat COVID when it is particularly serious, one would expect to have worse outcomes, and that's what we saw initially. Now they're thinking in terms of treatment, that delaying things like intubation and trying to keep people stabilized are working better in some cases. So I don't know how that's going to look in the long run, but there's no doubt that a high percentage of folks in your population who are over the age of 85 are fragile folks that will require more care. So it's a risk factor for sure. Also, what we know to date is that respiratory and lung issues of any kind are a particular risk. What we're looking at right here are ER visits for respiratory conditions. Respiratory in this case is grouping together several different respiratory issues, including COPD, as well as asthma. This slide is reflecting the adult population here in Missouri, so 18 and over. And we particularly wanted to look at ER visits because many chronic respiratory conditions are highly controllable. And if you end up in an ER with one, it's because something wasn't working for that patient in terms of their ability to control their respiratory condition. So it's a good proxy for overall access to health, overall access to health care. And these are looking at ER visits per 1,000. And again, as we look at this, the highest affected parts of Missouri are rural Missouri and around these kind of conditions, particularly in the southern part of the state. I didn't include the smoking slide, but I think it's important to point out that Missouri remains, particularly rural Missouri, one of the highest smoking rate states in the country. So it's not an issue that's going to go away easily. And another predictor that appears right now to influence poor outcomes for COVID-19 has to do with obesity. Obesity rates in Missouri are higher than the national average. Approximately 35% of adult Missourians fall within the obese range. And what we're looking at here are counties with the highest percent of BMIs. And, you know, in some cases, this is 35% or more of the population in these counties, up to nearly 50%. I'm not a clinician, so I don't want to attempt to speak to why this particular factor is a risk factor, but it appears to be. And then another important, I think, descriptor of the well-being and health in rural Missouri has to do with mental health. And while depression and related mental health conditions aren't necessarily predictors for poor outcomes for the COVID virus itself, you know, we all, I'm sure, are aware that there's a larger discussion going on about impacts beyond the disease itself and how to manage some of the health risks around a sudden economic downturn, around the personal impact of that in terms of job loss and layoffs and furloughs, lack of access to healthcare, and lack of access to other resources. And then, of course, just living in a moment of extreme unknown. So we can look at depression and depression rates. And again, you see this pattern of the slides that I've presented with a couple exceptions, like around the age demographics of the southern rural half of Missouri being particularly affected by some of these risk factors. So the depression rates in these counties, and this is a percent we're looking at here, are as high as 30% of the population with reporting depression as a condition through the Behavioral Risk Factors Surveillance Survey county level study. So then I want to switch gears here for a minute and look at the healthcare workforce. So I'm starting here with a map of the US, a county level map. And HRSA defines the health professionals shortage areas. The green color ramp on this map are rural, and the blue-purple color ramp are urbanized areas. And as you can see, when you zoom in there on Missouri, aside from our two large metropolitan areas, pretty much the state of Missouri falls into a HPSA area. So this is an issue of real concern here in Missouri. Hospital closures are an important issue in terms of dealing with COVID, as well as just the population health of Missouri's rural population. So this is from the Missouri Hospital Association. Since 2014, this was released in August of 19. Since 2014, we've lost 14 hospitals, and actually 15 because the hospital that closed in Boonville isn't on this particular map. As you can see, they're distributed across the southern part of the state pretty exclusively. And if you'll think back at the population health characteristics and social determinants we were looking at, there is a fairly close matchup going on here. So another way to think about access to healthcare is through primary care availability. I have a project at CHP with the Office of Rural Health where we are implementing HRSA minimum data set surveys across Missouri's health professions. This is looking at primary care physicians as a rate per 10,000 available in Missouri counties. And those white counties you're looking at are counties that have less than 10 primary care providers. We used a generous definition of primary care in this context. So we're thinking about people who are family medical clinicians, internal medicine, GPs, OBs, and pediatricians. So you can really see on this map where Missouri's medical regional trade centers are, and the amount of effort and driving that is incumbent on most Missourians to seek access to health care. And then finally, in terms of the maps, and I'll wrap up and do some questions. One thing that's happened during COVID as a federal policy response and a Missouri policy response is to quickly and successfully make telehealth more available to Missouri citizens. It's really pretty amazing. I think it's one silver lining of this moment, and something that we will take this experience and get much, much better at. What this is looking at is use of telehealth for Medicaid patients across Missouri counties. And it has been used and is used very frequently in rural areas. But again, there's a little bit of a mismatch between the counties displaying the highest need and the use of telemedicine. This is something that we're working on. And through the Missouri Telehealth Network, there are now Show Me Echoes available to broad audiences and providers for both COVID-19 as well as utilizing telehealth. And finally, and I can do questions from this, here are some resources around understanding the response at the federal and state level to COVID-19 specific to rural areas.
Great, Tracy, thank you. If you have a question for Tracy, please go ahead and include that in the chat screen, or you can also send me an email at roacham@missouri.edu. So to start our discussion, Tracy, I've read about how U.S. rural hospitals have had to furlough employees as elective procedures couldn't go on and other routine medical procedures and appointments were canceled. So how does healthcare-related job loss affect rural Missouri counties?
Well, it's hard to say. I'm not sure we completely know yet what that's going to look like. I would point out a couple things. I mean, the furloughs and layoffs have happened across the country, including in both metropolitan and rural Missouri, based on caseload and preparation for caseload. And things have started to open back up. To this point, the federal funding response has allowed many people in those positions to go ahead and utilize unemployment insurance. And I think that we're going to need to get farther out to really understand the long-term financial impacts of that. I'm sure many people on this call noted the news yesterday here in Missouri of Mexico, Missouri's very large, very short time span increase in cases. And I think that we're going to be in for a period where particularly rural hospitals are trying to manage that push-pull between doing regular business and being available for these sort of cluster outbreaks that will be hard on their resources.
Sure. So rural health clinics have been allocated around $225 million in federal funds to support testing efforts. So how is testing an important component of making sure that rural communities stay healthy? And then what are the parameters for how those federal funds can be used for testing? Are they just seeking out people who think they have symptoms and then are testing to confirm that they're sick? Or can testing be more widespread?
Well, that's a brand new policy, and I've been looking at it, Alice, since you sent me that question, and here's what appears to be happening. Of that $225 million, Missouri, about $17 million will come to Missouri, partly because we have a very large number of rural based clinics. But what the actual policy does is provide a $50,000 grant to clinics, and they can use it as their part of their COVID response. And there's a fairly wide range of things they can do with it. They can make sure that they have sufficient PPE. They can adopt policies around testing that conform to CDC protocols. And I think there's going to be some variation in how that looks, but it's going to be useful. Something I didn't mention earlier that I had under another slide, and it's on my resources list here, is Missouri Department of Health and Senior Services will start its first surveillance testing in the state at 10 different locations starting around the 1st of June. Boone County is one of them, and people can sign up. Their research for design for this makes it open to the public and free. It's a active virus test, not an antibody test. And I'm very excited and happy that DHS is moving into surveillance testing.
Great. So you mentioned that rural healthcare providers will need to be prepared for doing business as usual, and then also accommodating these cases, COVID cases, as they pop up. So what can they do, and what can communities do to prepare now in the event that they do see sort of a cluster of COVID cases arise at some point in the future?
Well, they can be informed and ready to go. And I think that, the rural health associations, CDC, and the administration here in Missouri have done a fine job of preparing clinicians and healthcare administration for dealing with that on a local basis. They can ensure that they have PPE available. They can coordinate with other both clinical providers and leaders, institutional leaders in their communities, so that when an outbreak occurs, it's a community response around things like social isolation and quarantining of active cases, and that there's a good support network in place. And, as we know, this is more and more, this is a respiratory-borne illness. So having systems in place in communities where people are managing their interaction with each other is going to be really important.
Great. I've heard, or COVID-19 has some influence on access to food, and access to food has influence on health, obviously. And I've heard that some anecdotes have suggested that the pandemic has increased sales among rural grocery stores because consumers are buying closer to home. If they're not going into an urban area for work, then they may not be stopping in that urban area to buy food, for example. So is this a trend that you're seeing in Missouri, and how does this trend affect the potential long-term viability of rural grocery stores?
So this is another question that you sent me, Alice, that I started looking around about. And one thing I wanted to mention is that Kansas State, through their Rural Grocery Initiative, ruralgrocery.org, is doing a deep dive into this issue, and I encourage people to take a look at that. The analysis that I've seen to date suggests that we don't know if this is going to have a long-term impact, and that there are several factors that might impact it. One, rural groceries, like any grocery, is impacted by supply chains. So if food shortages around particular areas become intense, rural groceries are going to feel that like everybody else. If there are areas where there are outbreaks and lots of hospital transfers and people moving more to regional medical trade centers for services, that's going to shift the retail that happens around that back to the regional medical trade center. And essentially, it's a little bit of a question mark. I will say that early in April was when there was a lot of coverage of people's travel patterns changing. as a result of stay-at-home orders, and that as things have loosened up via cell phone tracking and that sort of thing, it's obvious that Americans are moving back to patterns where they move around more. And I would anticipate that their retail patterns will reflect that too. So I'm hopeful that it's a surge and a silver lining for rural groceries, but I don't think it's clear yet what's going to happen.
Great. Well, thank you for responding. And thank you, Tracy, for sharing today's webinar presentation too. Time to close today. Thank you to our audience also for joining. When you exit Zoom, you'll see a post-webinar survey will load in your browser. If you could please consider responding, we'll use the results to improve the webinar experience and also brainstorm future webinar topics. Again, you should receive a webinar recording via email within about a day from now, so you can look for that email from Zoom. The Missouri webinar series resumes tomorrow on Thursday, May 29th, as Dr. John Cruz will speak about how row crop producers can make use of the Coronavirus Food Assistance Program, which is otherwise known as CFAP. So thank you again for joining us, and I hope to see you again tomorrow. Thanks, Tracy.
Thank you, guys.